Hello to everyone. My name is Dr. Kateryna Tsvyetkova. I was born in Kiev, capital of Ukraine, and I graduated from Medical University in Kiev. And I also have got 30 years of medical and research experience in the Research Center of Obstetrics, Pediatrics and Gynecology. I've got also Ph.D. in children pulmonology. I am also registered as homeopath internationally in South Africa and in Ukraine. Being a very much conventional doctor, I was also interested in a different kind of holistic therapy. One of the most interesting thing for me was to learn different kind of breathing exercises. And the most interesting technique I found was the breathing exercises that was introduced by Strelnikova, Russian singer, who was doing breathing exercises to prevent a lot of illnesses like bronchial asthma, obstructive bronchitis, arteriosclerosis, and a lot of others. I did particularly like these exercises by Russian singer Strelnikova because it can expand our lungs and push maximum amount of oxygen in our tissue. So I started to develop it further and put these breathing exercises into a specific structure of physical exercises that I called vital energy diaphragmatic breathing technique. The benefits of this technique is enormous. First of all, it can prevent or alleviate any kind of symptoms of viral infection, including COVID-19, as while you're doing it, you control the immune protection in your nostrils and in upper respiratory tract. Secondary, these exercises can improve your metabolism and it can bring the cholesterol level, sugar level, and the triglycerides level to a normal amount in our bloodstream. Thirdly, because you're doing a lot of stretching exercises, it can control the activity of our joints and it can prevent any kind of a stiffness or inflammation in them. These exercises, particularly, do not have any kind of hyperventilation, any increase in the pulse rate, and has no muscular cramps. When you do it correctly, you feel so elevated, so lifted, so happy, and so strong after them. When you do these exercises every day, you feel much stronger, much happier, with less of cellulite, with less of memory loss, and even aging process. So when you particularly do this breathing technique, you do not produce any hyperventilation, any muscular cramp, any high pulse rate. To fulfill these exercises, you need 4 things. You need a little bit of a patience, you need a little bit of a space, you need 2 chairs, and you need to have a little bit of time. So when you do these exercises, it's very important to remember to do it correctly. So because of that, and it's a very difficult technique for somebody who is suffering from bronchial asthma and other metabolic and other medical conditions, my presentation on breathing exercises will be consisting of 4 parts. The first one is theoretical part, as you can and you have to understand how these breathing exercises can improve your metabolism, can improve your immune activity, and how you need to involve correctly your diaphragm. The second part will be the correct diaphragmatic breathing. The third part will be our exercises, and we will learn from one to another how to do it correctly and how to involve diaphragm in a maximum way to expand our lungs and to get maximum amount of oxygen to our tissue. And the fourth one will be about prevention of flu. So what do you need to do with this breathing? How you need to breathe when you're having first attack of viral infection or you've been exposed to viral infection somewhere.